You've been doing the exercises, you've been trying to do everything right, but every time you perform certain movements, your back pain or your leg pain gets worse. And now you're wondering if the exercise is meant to help your disc bulge or actually making it worse. If that sounds familiar, you're not alone. Every week I see people who have been told they have a disc bulge, stenosis, a pinched nerve, or several different problems all at once, and nobody has explained which condition should be guiding their exercise program. In this video, I'll show you why standard disc bulges exercises can actually aggravate certain spinal conditions, how to tell if your current exercises are helping or hurting your recovery, and the simple test you can use to find the movement direction your spine responds to best. Stay with me, because by the end of this video, you'll know whether your current exercise program is helping your recovery or keeping you stuck in the same cycle of flare-ups, and what type of exercises may be a better fit for your spine. Hi, I'm Dr. Kevin Wafer, a chiropractor in Houston, Texas. The disc bulge trap is believing that every disc bulge should be treated the same way. One of the biggest frustrations I hear from patients is that they've been told they have a disc bulge, stenosis, degenerative disc disease, a pinched nerve, or several different findings on an MRI, yet no one explains which condition should be guiding their exercise program. So they do what most people would do. They search for disc bulge exercises, start doing them consistently, and expect the symptoms to improve. Sometimes they do, but sometimes the exact opposite happens. Their back pain increases, their leg pain travels further down their leg. They finish the exercises wondering whether they're actually helping themselves or making things worse. Have you ever had an exercise that seemed to aggravate your symptoms instead of relieving them? Most people assume they're doing the movement incorrectly. What I often find, though, is they're performing the exercise exactly as instructed. The real issue is that the exercise may not match what their spine needs right now. One of the biggest misconceptions about disc bulge exercises is that if a movement helped someone with a disc bulge, it should help everyone with a disc bulge. But that's not always what happens. Instead, what I see is one person performing an extension exercises and feeling relief almost immediately, while someone else notices more pressure, more irritation, or pain traveling further down their leg. Many people are not dealing with a disc bulge alone. They may also have spinal stenosis, instability, degenerative changes, or other findings that can change how their spine responds to movement. This is where many people get confused. Someone may be told that they have a disc bulge and lumbar stenosis and assume they should automatically follow stenosis exercises. But not all stenosis is the same. In some people, lumbar stenosis is primarily related to degenerative changes, thickening of the ligamentum flavum, enlarged joints, and narrowing of the spinal canal over time. Those individuals often feel better in a forward bent position and may respond more favorably to flexion-based movements. In other people, a posterior disc protrusion or disc herniation may be contributing significantly to the narrowing of the spinal canal and producing classic disc-related symptoms, including pain that travels down the leg. Even though stenosis may appear on the MRI, the disc can still be the primary driver of the symptoms. That's why two people with the same MRI findings can respond completely differently to the same exercise. The MRI tells part of the story, but the symptom response tells how the spine reacts to movement. This is also why a thorough exam and a careful review of imaging and an understanding of how symptoms respond to movement are all important when determining which exercises may be the best fit for your situation. The question isn't whether an exercise is good or bad. The question is whether it's helping your symptoms or aggravating them. And the good news is you don't have to guess anymore. In a moment, I'm going to show you a simple way to find out how your spine responds to movement, and it only takes 30 seconds. As always, this video is not intended to diagnose your condition. These tests are meant to help you better understand how your symptoms respond to movement, but they should never replace an evaluation by your physician, a chiropractor, physical therapist, or other qualified healthcare professional. If you've been doing extension-based disc bulge exercises, or you've been told to perform movements like the cobra stretch, press-ups, or lying on your stomach and propping yourself up on your elbows, this quick extension test can give you valuable information. Lie down on your stomach on a firm surface, then gently prop yourself up on your elbows. Don't push all the way up with the hands. Just rest comfortably on your forearms and hold that position for about 30 seconds. As you're holding that position, pay attention to your symptoms. Do you feel your back pain easing? Does your leg pain decrease? Do your symptoms stay about the same? Or do you feel more pressure in your lower back? More pain in the buttocks, thigh, calf, or foot? Take a moment and really notice the response. One of the biggest mistakes people make is rushing through the exercise without paying attention to what their symptoms are telling them. The patients who improve fastest usually become very aware of how their body responds to specific movements. They stop guessing and start observing. What we're looking for here is not whether the position feels difficult. We're looking at what happens to your symptoms. If your symptoms improve, or if pain was traveling down your leg starts moving back toward the lower back, that's often a positive sign. We call that centralization, and it's usually something we look to see during rehabilitation. If your symptoms increase, or if pain starts moving further down the buttock, thigh, calf, or foot, that's also important information. That's called peripheralization, and it tells us this movement may be irritating the structures contributing to your symptoms. Before you make any decisions based on this result, I want you to compare it to one more movement. The next test is especially important if you've been told you have spinal stenosis, degenerative disc disease, instability, or other multiple findings on your MRI. What happens during this second test often helps clarify whether they're moving in the right direction or working against your symptoms. Sit towards the front of the chair with both feet flat on the floor. From there, slowly lean forward and bring your chest towards your thighs. Don't force the movement. Just move into a comfortable position and hold it for about 20 to 30 seconds. As you're holding that position, pay attention to the same things you noticed during the first test. Does your back feel more comfortable? Do your leg symptoms ease up? Do you feel less pressure? Or do your symptoms become more noticeable? Think about what happened during the extension test and compare it to what happened right now. Most people assume they need to find the best exercise. What we're really trying to find is the direction of movement your symptoms respond to most favorably. What I see quite often is someone struggling with extension-based exercises for weeks or months, then discovering that a gentle forward bending position immediately feels more comfortable. On the other hand, some people feel significantly better in extension and worse when they bend forward. Those responses help explain why a standard disc bulge exercise program may have been helping doing very little or making symptoms worse. So let's put these two tests together. If the extension position reduced your symptoms or moved back out of your leg and back towards your lower back, while the forward bend made symptoms worse, that suggests your spine may respond better to extension-based movements. If the opposite happened and the forward bend reduced your symptoms while extension increased them, that suggests your current exercise approach may need to be reconsidered. One of the biggest mistakes I see is people continuing an exercise simply because they were told it was good for a disc bulge, even when their symptoms are clearly telling a different story. Have you noticed a clear difference between the two positions? If so, you've already learned something important about how your spine responds to movement. Now, let's look at 2 exercises for people who responded better to extension and 2 exercises for people who felt better with forward bending, so you can start matching your exercise program to the results. Let's start with the group that felt better during the extension test. If the extension position reduced your symptoms or moved pain out of your leg and back towards your lower back, that may suggest that your spine responds favorably to extension-based movements. The interesting part is that the test itself is essentially the exercise. What I want to show you now is how the movement is commonly used, how long it's typically held, and how some people incorporate it into their day when it produces a favorable result. The first exercise is standing lumbar extension. This is a great exercise because it can be performed almost anywhere. If you spend a lot of time sitting at a desk, driving, bending over a counter in the kitchen, working in the garden, or doing anything that requires frequent forward bending, this is an easy movement to work into your day. Stand with your feet about shoulder width apart and place both hands on your lower back for support. From there, slowly lean backwards into a comfortable extension position. Move gradually and only as far as it feels comfortable. There's no need to force the movement or push into pain. Once you reach a comfortable position, hold for 10 seconds before returning to standing. Take a moment to relax and then repeat the movement. You can perform up to 10 repetitions. Many people find this exercise especially helpful during the day because it can be done quickly without needing to get down onto the floor. It can be a useful movement after long periods of sitting, driving, desk work, or repeated forward bending exercises. The second exercise, prone lumbar extension, is often easier to perform at home, especially first thing in the morning or before going to bed. Begin by lying comfortably on your stomach. Slowly prop yourself up onto your elbows while keeping your hips and pelvis relaxed against the surface. Hold that position for 10 seconds, then slowly lower yourself back down. Repeat up to 10 times. One of the advantages of the prone lumbar extension is that it gives you a built-in progression. You can start with a gentler elbow-supported position, When you're ready, place your hands underneath your shoulders and press up into a full arm extension while keeping your hips in contact with the surface. Hold that position for 10 seconds before lowering yourself back down with control. Repeat up to 10 times. This allows you to gradually increase the intensity of the exercise over time, which is something you can't easily do with standing lumbar extension. Not everyone responds best to extension-based movements. Some people discover that forward bending positions provide more relief, and those are the people we're going to talk about next. If the forward bending test reduced your leg symptoms, decreased pressure in your lower back, or felt noticeably better than the extension test, that may suggest that your spine responds more favorably to flexion-based movements. The interesting part is, just like the extension group, the test itself is essentially the exercise. What I want to show you now is how that movement is commonly used, how long it's typically held, and how some people incorporate that into their day when it produces a favorable response. The first exercise is seated forward flexion. This is a great exercise because it can be performed almost anywhere. If you spend a lot of time standing, walking, or notice that upright positions tend to aggravate your symptoms, this can be an easy movement to work into your day. Sit towards the front of a firm chair with both feet flat on the floor. Slowly lean forward and bring your chest towards your thighs. Move gradually and only as far as feels comfortable. There's no need to force the movement or push into pain. Once you reach a comfortable position, hold for 10 seconds before returning to an upright seated position. Take a moment to relax and then repeat the movement. You can perform up to 10 repetitions. Many people find this exercise especially helpful during the day because it can be done quickly without needing to get down onto the floor. It can be a useful movement when symptoms begin increasing during prolonged standing, walking, or other activities that keep the spine in a more upright position. The second exercise is a double kneaded chest stretch. This exercise is often easier to perform at home, especially when you have a few extra minutes available to focus on your mobility. Begin by laying comfortably on your back with both knees bent and your feet resting on the floor. Slowly bring both knees towards your chest and gently hold them with your hands. Once you're in a comfortable position, hold for 10 seconds before returning your feet to the floor. Repeat up to 3 times. One of the advantages of the double kneaded chest stretch is that it allows you to increase the amount of flexion gradually based on your comfort level. Some people begin by bringing their knees only partway towards the chest, then gradually work into a deeper position over time as tolerant. Many people find this exercise works well at the beginning or the end of their day, particularly when they've had enough space to relax and move through the exercise without rushing. Just as some people respond best to extension-based movements, others respond better to flexion-based movements. The goal is not to force your spine into a particular category. The goal is to find the right movement direction that your testing suggested may be a better fit for your symptoms. I hope this video gave you some clarity. If you've been confused about which exercises are right for your condition, I hope this video helped you better understand how your spine responds to movement. Remember, the goal is not to find the most popular exercise on YouTube. The goal is to find the movement direction that appears to work best for your symptoms. If you're looking for more complete exercise routines, I have several videos on this channel covering extension-based exercises for lumbar disc bulges and herniations, as well as flexion-based exercises commonly used for lumbar stenosis. I've placed links to these videos in the description below. If you found this video helpful, please give it a like and share it with someone who may be struggling with back pain, leg pain, sciatica, disc bulge, or stenosis. It also helps YouTube find many people who may benefit from this information. I'd also love to hear from you. Leave a comment below and tell me what you discovered during the tests. Did you respond better to the flexion-based movements or the extension-based movements? And if you're new to the channel, make sure to subscribe because I upload videos like this every week that help you better understand your condition, make sense of your symptoms, and make a more informed decision about your recovery. If you're still struggling to get lasting relief from a disc bulge, herniation, spinal stenosis, or ongoing back and leg pain, a more targeted approach may be needed. In the next video, I explain how we use non-surgical spinal decompression to address the underlying cause of back and leg pain. Go watch this video next and see how we help patients move beyond temporary relief, work toward long-lasting improvement, and get back to enjoying a normal quality of life.